Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to answer a question that a lot of you tend to ask me in a comment section on a lot of my YouTube videos, and that is, how do you know if you're ready to start gender transition? And that's, first of all, that's a very loaded question, because not knowing your history or not being able to work with you directly, that's something that's completely outside of my reach to answer as a clinical psychologist, nor would I ever attempt to. But I really want to bring your attention back to your own question, because I think the fact that you're asking whether or when will you know if transition is right for you is an indication of a level of uncertainty in relationship to your gender. And so what do I mean by that? There's a big difference between people who know for sure they are transgender, know for sure they're struggling with gender dysphoria, and are not sure whether they want to start gender transition because they're afraid of any kind of potential things that might come with gender transition. Big difference. Versus somebody who is not even sure if they might be transgenders. They think they're dealing with gender dysphoria and tearful, wondering when is the right time to start gender transition. And if you fall in the category of people who are not really sure whether you might be trans or not, but you're thinking you need to start gender transition, I want you to really stop yourself and spend some time on your gender identity. Transition is a serious undertaking. There's a lot of irreversible things that come with gender transition. Transition is not a process that I tend to cheerlead people in. Now, of course, there's people who struggling severely with gender dysphoria and truly do have gender dysphoria and need to go through gender transition because that's part of the medical process, especially if transition is a goal for them. But it's not something to be taken lightly. It's not something that you try on as a way of trying to figure out your gender identity. That's just not the way to do it. The safest way to figure out your gender identity, if you're that confused, is to start social transition. Social transition, and I've done a video detailing what social transition entails, and I will link it for you below, is basically undertaking a lot of things that you can do in order to explore your gender, especially in order to explore your gender expression in relationship to yourself in a safe form. And what I mean by safe form, I mean doing things that are not going to cause any kind of irreversible changes. So for example, you can either grow your hair long or cut your hair short. You can change your clothing style. You can wear a different type of either masculine or maybe feminine clothing or gender bending clothing. You can do that. You can also change any kind of expression in the way you carry yourself or in the way you come across. You can also change your name. Not legally, I wouldn't recommend it until you're sure you want to do that, but you can ask people around you to call you by your preferred name or by your preferred pronouns. There's a lot of things you can do safely to experiment and explore your gender and see what really feels comfortable. Remember, gender identity and gender dysphoria tend to intertwine, and they can be very confusing to figure out where you fall in and whether you truly are struggling with gender dysphoria. Gender transition, especially medical transition and surgical, is something you should not be undertaken until you're sure you identify as transgender, you're struggling with gender dysphoria, and that's your goal. You really want to transition because your goal is to feminize or masculinize some parts of your physical characteristics. Other than that, you shouldn't really be undertaking it. Again, as I said many times, gender transition is a serious process. It's not something that you can try on and then say, oof, it didn't work for me, I'm going to do transition. That's really not how it works. And frankly, I think that's why we see a lot of young adults and a lot of teens doing YouTube videos talking about it. They seem to be the only demographic group of people who tend to talk about transitioning and detransitioning. I think that's because they really haven't spent much time exploring their gender. And I think that's something that's really important and something that should be really important to you. Therefore, you really need to be mindful and careful about it. So if you're one of the viewers that tend to ask me whether you should start gender transition, just the fact that you're asking that alone is an indication that there's a part of you that's not even sure about your gender. So spend some time exploring your gender identity in a safe format Give yourself some time to figure out how you identify, and especially in relationship to your biological sex. And if you can possibly seek a professional help, somebody that you can maybe talk to and explore the things, somebody that knows how to ask just the right type of questions to lead you down exploration path. Hopefully this is very helpful to you. Comment below, let me know what you think. Those of you who have transitioned or are transitioning, understand how serious it is and understand how life-changing it is. So please also comment below, because again, we want to help people transition, and we don't want to create gatekeeping rules, right? So if you're truly struggling with gender dysphoria, we want you to have access to medical treatment. But we also don't want everybody to jump into medical treatment if that's not for you, and if you have that much level of uncertainty that just becomes unsafe and not a healthy thing to do. So comment below. I'd love to hear from you, and I'll talk to you guys all next time. Bye.